dear friends, colleagues, ladies and gentlemen, a very good afternoon to all of you. Thank you for joining us virtually for today's official opening of Changi General Hospital Wound Healing Center. Before we commence, please be informed that photographs and videos will be taken during this virtual event for publicity, education, or other related purposes by Changi General Hospital. Thank you. Ladies and gentlemen, a very good afternoon to all of you. Thank you for joining us at the official opening of the Changi General Hospital Wound Healing Center. My name is Jia Ming and I will be your MC for today. We are honored to have with us here today our guest of honor, Senior Minister of State, Ministry of Health and Ministry of Manpower, Dr. Koh Poh Koon. Senior Minister of State, Dr. Koh Poh Koon, Mr. Cheng Wai Keong, Chairman of SingHealth, Mr. Koh Chun Hui, Chairman of Cellogenics, distinguished guests, ladies and gentlemen, welcome to the official opening of the Changi General Hospital Wound Healing Center. Helmed by a team of specialists and nurses trained in the full spectrum of wound management, the CGH Wound Healing Center focuses on early intervention and fast-track treatment of chronic wounds. This afternoon, I'm pleased to bring you on a virtual walkthrough of Singapore's first patient-centered, multidisciplinary outpatient facility dedicated to wound care. Without further ado, let us invite Professor Ng Wai Ho, Chief Executive Officer, Changi General Hospital, to deliver his welcome remarks. Professor Ng, please.
Yeah, thank you. Dr. Koh Poh Koon, Senior Minister of State for Health and Manpower, Mr. Cheng Wai Keong, Chairman of Sing Health, Mr. Koh Chun Hui, Chairman of Cellogenics, Mr. Kurt Wee, CEO of Cellogenics, distinguished guests, friends, and colleagues. First of all, I'd like to wish all of you a very warm welcome to the official opening of the Changi General Hospital Wound Healing Center. Thank you for taking the time to join us on this significant occasion. I think we're all familiar with this saying that time heals all wounds. Regrettably, I think that sometimes this saying is really a fantasy. We know that psychological and emotional wounds are not always healed by time, and certainly physical wounds such as chronic wounds and pressure injuries do not heal normally with time, but rather requires timely and appropriate intervention. So time certainly doesn't heal, but timeliness brings healing. Allow me to share with you the story of Mr. Lee, a personal wound story. Mr. Lee is actually with us virtually today at this event, and so thank you, Mr. Lee, for allowing us to share your story. And he is scheduled for his follow-up treatment at the wound center right after this event. So Mr. Lee is actually a beneficiary of the Wound Healing Center. Like many of us who suffer from similar health conditions in Singapore, Mr. Lee has what we commonly call the three highs: high cholesterol, high blood sugar, and high blood pressure. He is a 74-year-old retiree who does regular exercise and does look after his weight control, but not so well at times. He smokes regularly, and it certainly didn't help to make things any better. So with his poor diet, weight problems, and smoking, Mr. Lee discovered that he had multiple black patches on his lower limbs, which he initially discounted and didn't think too much of. He was waiting to see if time will heal and whether these wounds will recover over time. It was only when a family friend who happened to be a doctor who pointed out to him that the condition looked significantly severe that he went to the emergency department at CGH and was assessed that the condition was severe enough for him to be hospitalized. One look at these black patches, the doctors diagnosed it that the condition was attributed to blocked arteries from his thighs to his toes, which restricted blood flow and resulted in the medical condition known as gangrene. He had to undergo surgery to open up the blood vessels and to remove and clean the dead tissues on his feet. Unfortunately, the infection was really too deep-seated and extensive, and he had to undergo amputation of 2 toes, 1 on each foot, and therefore lost actually 1 toe in each of his feet. Mr. Lee was then referred to the Wound Healing Center located at the Medical Center of Changi General Hospital for further management. He has been having reviews at the center about 3 times a week, seeing both our vascular and plastic surgeons, as well as for regular wound dressing. Fortunately, he's now taken the proactive steps to lose weight and quit smoking so that he can quickly resume his daily activities. We are very happy that Mr. Lee is recovering well, and the Wound Healing Center aims to help more patients like Mr. Lee. And Mr. Lee, incidentally, is just one of over 50,000 patients in Singapore with diabetes who are at risk of developing similar limb complications in their lifetime. So there are important learning points from this experience that we can share with our community, especially with our senior population and particularly people with chronic diseases. When we have a wound that doesn't seem to recover after a month or so, do not neglect it or let it fester any longer. Some wounds can deteriorate quickly, become infected, and if we delay treatment, it will cause much more pain and disability and could even lead to the loss of our limbs if left untreated. So as we mentioned, as we like to say, time really doesn't heal, but timely intervention does. Even in an excellent healthcare system like ours, care is often delivered in a fragmented fashion, causing confusion for patients with multiple visits to see different specialists, often suboptimal coordination, which can lead to less than ideal health outcomes. At CGH, we strive to be a caring general hospital, and what we have aimed to do is to re-examine, to reimagine, and to redefine wound care for these patients. First, we re-examine the current model of care for various groups in the community who are prone to chronic wounds by introducing preventive measures to keep them healthy and to prevent them from developing wound problems. We have deep knowledge and expertise in the full spectrum of wound management over the years. Secondly, we reimagine an integrated care solution by bringing together expert team from multiple disciplines, from orthopedics to vascular surgeons to plastic and reconstructive surgery, and they are supported by wound specialist nurses, podiatrists, radiographers, physiotherapists, and dietitians who all play a key role in diagnosing, caring, and journeying with our patients on their road to recovery. And finally, we redefine care by designing a seamless one-stop journey to provide easy, rapid access and convenience to wound care sooner. And we encourage everyone with wounds that do not seem to heal to seek medical attention for their wounds early so that we can help them have the best outcomes possible. The opening of the Wound Healing Center is only the beginning of the chapter, and we believe that the coming together of CGH's clinical expertise, scientific expertise, and SingHealth as a whole, in collaboration with Celogenics stem cell research capabilities, will drive wound care research and treatment to the next level for our patients. As we like to say, our patients are at the heart of all we do. I would like to thank our distinguished guests, our friends and colleagues and collaborators for your presence at this event, and I wish you all a pleasant day ahead. Thank you very much.
Thank you, Professor Ng. It is now my pleasure to invite guest of honor, Senior Minister of State, Ministry of Health and Ministry of Manpower, Dr. Koh Poh Koon, to address us. SMS Koh, please.
Thank you. Mr. Ching Wai Kiong, Chairman of SingHealth, Professor Ng Wai Ho, CEO of Changi General Hospital, Mr. Koh Chun Hui, Chairman Celogenics, Mr. Kurt Wee, CEO of Celogenics, colleagues and friends, distinguished guests, ladies and gentlemen, very good afternoon. It's a real pleasure for me to join you today at the official opening of the Wound Healing Center by Changi General Hospital. Now, chronic wounds are a common problem in the wards in healthcare, especially among the elderly with underlying health conditions such as diabetes, cardiovascular and peripheral vascular diseases, and those with reduced mobility. Chronic wounds bring pain and emotional stress to those who are affected, and even family members and caregivers are also burdened by the need to also look after these wounds. Studies have shown that about 2% of the population will experience a chronic wound during their lifetime in developed countries. When I was practicing colorectal surgery, having an unhealed surgical wound is also a nightmare scenario that I fear the most. In Singapore, we are seeing a rising prevalence of chronic medical conditions that are associated with the development of chronic wounds. Amongst these conditions, diabetes mellitus predisposes patients to chronic wounds from injuries related to diabetic peripheral neuropathy, as well as poor wound healing that results from arterial insufficiency or peripheral vascular disease, a very common complication from chronic or poorly controlled diabetes. In fact, a study showed that diabetes contributed to 87% of the arterial insufficiency ulcers in our own local population. Another study showed that the length of stay for a patient with a chronic wound is likely to take 2.4 times longer than the average length of stay of all admissions within the same institution. Recurring chronic wounds therefore consume healthcare resources, reduces productivity, and increase caregiver burden. So you can see from this statistics and data that management of chronic wound is a very complex, but also a very important issue in our overall healthcare landscape. Chronic wounds that heal poorly may have multiple etiologies, where the underlying causes may not be obvious without further investigations. For example, Madam Talisa is a patient with diabetes and chronic renal failure on dialysis support, who had a blister on the toe a month ago, something that seems quite innocuous. She was referred to an orthopedic specialist for an evaluation. An early scan actually revealed critical narrowing of the blood vessels supplying the foot, and vascular surgery was performed to re-establish blood flow to this area with a reduced blood supply, what we call an ischemic area. However, for her, the blister became infected, and a decision was made to amputate the toe to prevent further spread of the infection and a greater loss of a lower limb. There are others who may not have early detection of the underlying causes of their chronic wounds and could therefore encounter much more severe consequences than just losing a toe. And this has also led to a lot of caregiving burden when a limb needs to be amputated. The healthcare challenges associated with chronic wounds are multifaceted and requires a reframing of our approach to patients at risk of chronic wounds. In addition to managing tertiary acute episodic care of salvaging end-stage complications, we need to move upstream to enhance our efforts to avoid complications that may lead to potential loss of limbs and lives. For example, primary and secondary prevention aim to prevent chronic conditions from developing or to improve the management of chronic conditions to prevent their progression to complications over time. Regular surveillance of at-risk patients as part of tertiary prevention, such as our diabetic foot screening program, aims to diagnose and treat complications early to mitigate the long-lasting impact of the complications if these were left uncontrolled. These prevention efforts cannot be done in isolation, and it requires the cooperation of many different stakeholders, including the specialists, the allied health, nursing, and primary care, and also involves education of the patients so that they are aware and empowered to take the necessary actions themselves. To improve and streamline the care for patients with chronic wounds, Changi General Hospital has set up this Wound Healing Center, which officially opens today. And as you heard from Professor Ng earlier, this is a patient-centric, one-stop outpatient facility focusing on early intervention and fast-track treatment of chronic wounds, helmed by a multi-disciplinary team of specialists and nurses from various departments, from the vascular surgery, orthopedic surgery, and plastics, reconstructive, and aesthetic surgery teams. These integrative services work with other relevant specialists looking after the concurrent medical conditions to provide the holistic care that will achieve the best outcomes for our patients with chronic wounds. So with this service, patients are now able to receive a whole suite of services ranging from diagnostic tests, assessments, and treatments all within the same day. And at steady state, the Wound Healing Center aims to provide an average of 1,000 wound-related consultations and procedures each month. And as you heard from Professor Ng, timely access to outpatient treatment is critical and would help reduce avoidable emergency department attendances, hospitalization, and readmissions. In this whole process, nurses play an integral role in wound care management because they journey with the patients on their road to recovery. At the Wound Healing Center, wound care nurses, together with the vascular and geriatric advanced practice nurses, manage extensive and complex wounds that require very close monitoring. Nurse clinician Ong Ling, who is part of the team of wound care nurses, performs advanced wound care procedures on patients and educates caregivers on wound dressing techniques, as well as identification of wound deterioration. More than that, Sister Ong Ling is also a listener, cheerleader, and health and wellness educator. I've known Sister Ong Ling for many years now. I think when we were just starting out in both our separate careers, we happened to do a rotation together in plastic surgery, where we managed many of these complex wounds. So I can attest to the fact that Sister Ong Ling is exactly that, a listener, a cheerleader, and a patient educator. And I'm sure she will add a lot of experience and depth to the team in this new Wound Healing Center. Apart from keeping up with research and clinical trials updates, it is also very important for us to take a proactive approach to leverage new technology and to improve patient outcomes for wound care. I'm happy to share that CGH Wound Healing Center will work with Celligenics on studies to explore the role of stem cell treatments in wound healing. It is hoped that this may reduce the incidence of infections and associated complications with chronic wounds to ultimately improve the quality of life of the patients. The MOU, the Memorandum of Understanding, will be signed today, and CGH will act as a testbed for the development of the technologies. The advancement of chronic wound care will improve the quality of life for individuals and bring cost savings to our healthcare system here in Singapore, and more importantly, to other patients around the world as well. So I want to wish CGH success in the care of patients with the setup of the Wound Healing Center, and I look forward to seeing you reach greater success and, in fact, increasing your capacity to manage even more patients beyond the 1,000 that you estimated. So thank you very much for having me here, and all the best to all of you. Thank you very much.
Thank you, SMS Koh. We would now like to invite SMS Koh to officially open the CGH Wound Healing Center. May I also invite Mr. Ching Wai Keong, Chairman of SingHealth, Professor Ng Wai Koh, Chief Executive Officer of CGH, Dr. Derek Ho, Director of CGH Wound Healing Center, and Ms. Peng Gek King, Co-Director of CGH Wound Healing Center and CGH Chief Nurse, to join us on screen for the launch, please. Now I would like everyone to move your cursor to the launch button on screen. On the count of 3, we will initiate the launch together. 1, 2, 3.
As we move through the tunnel, the colors change to a healthy skin beige, signifying the recovery journey of complex wounds with the full continuum of care at the center.
Congratulations on the official opening of the CGH Wound Healing Center. May we invite everyone to remain on screen to take a virtual photo, please. On the count of 3, 1, 2, 3. Thank you, SMS Koh, Mr. Ching, Professor Ng, Dr. Ho, and Ms. Peng. So at the CGH Wound Healing Center, patients can receive holistic and dedicated wound care within the same day from diagnostic tests, assessments, and treatment, and with access to specialties such as vascular surgery, orthopedic surgery, and plastics, reconstructive, and aesthetic surgery. With timely access to outpatient treatment, avoidable hospitalizations can be reduced. We would now like to invite you to take a walk through the patient journey at the CGH Wound Healing Center with our center's director and co-director, Dr. Derek Ho and Ms. Peng Gek King.
1 in 20 Singaporean is estimated to experience a chronic wound within their lifetime. With our aging population, elderly usually have comorbidities such as diabetes, cardiovascular disease, peripheral vascular disease. These risk factors actually can impair their healing. With the increased demand of wound care in the community, Changi General Hospital has assembled a team of passionate specialists about wound care across various disciplines and set up a wound healing center in May 2021. Our aim is very simple. All patients in the community should have early and easy access to our service. We want them to discover their wound early, seek treatment early, and potentially prevent the complications of a chronic wound. From a small wound such as a toe wound, it may develop into gangrene, infection, and an amputation of the leg. If patients seek early treatment and come to the wound healing center early, these potentially can be prevented. A lot of the patients coming to the wound healing center, they are elderly and they have poor mobility. A lot of them are on wheelchair. In order to come to the wound healing center for the consult, sometimes they have to call a taxi or even an ambulance to bring them here. As much as possible, we will want to make their journey to the wound healing center a seamless one as possible. This is the consultation room, their first stop in the journey in the wound healing center. Together, the patient is seen with the wound specialist nurse. A proper assessment of the physical examination and the history of the patient is taken here. At the same time, we will examine the wound and do a wound assessment as well. We want to find out what is the underlying cause that caused this chronic wound to not heal, and hopefully we can find an answer. And indeed, if we manage to find something suspicious, let's say a blocked blood vessel, we can do a diagnostic test on the same day. We have 2 dedicated ultrasound rooms within the wound healing center. In the initial consult with the patient, let's say a blood vessel problem is found and there's not enough blood flowing down to the foot to heal the wound, we will then do an ultrasound scan of the blood vessel on the same day. The patient now is undergoing an ultrasound scan of the blood vessels. This is to assess whether there's enough flow of the blood to the wound. This procedure takes about 30 minutes and is pain-free. After the procedure is done, the result then will be passed to the clinician. Based on the blood flow of the leg, we will decide whether there is enough blood to heal the wound and will decide on the next step of our treatment. If the blood flow is good enough, the wound specialist nurse will then proceed on to debride the wound and wrap up the dressing, and the patient potentially can go home. And let's say if the blood vessel is blocked, then the patient may have to be admitted to the hospital and undergo a blood vessel surgery.
Our team of wound care nurses play an integral role in wound care management as they journey together with the patients on their road to recovery. The best way to treat a chronic wound is to regularly clean, assess, and use the appropriate wound dressing. At Wound Healing Center, our wound care nurses, together with vascular and geriatric advanced practice nurse, manage extensive and complex wounds that require close monitoring. They perform wound care procedures on patients including conservative sharp wound debridement, electrical stimulation therapy, and compression bandaging, which help to enhance wound recovery. Caregivers at home also play an important role in patients' wound care recovery. Our wound care nurses educate caregivers on wound dressing technique as well as identification of wound deterioration so that early action and treatment can be taken. The Wound Healing Center provides a full spectrum of care for patients with complex care needs from hospital to home. The wound nurses, together with clinic as well as community nurses, are trained and well equipped to provide care and support to patients and minimize the occurrence of readmission.
Our patients and caregivers are important partners in the wound recovery journey, and truly, they're at the heart of all we do. Mr. Lee Kim Loon, a patient at our Wound Healing Center, and his daughter and caregiver, Madam Lee Choi Foong, share about their wound recovery journey from hospital to home.
这是我的父亲，他有三高，高血压、高胆固醇跟糖尿病。他也是一个heavy smoker， 他一天可以抽大概1包的香烟。在7月中的时候，我妹妹的一个医生朋友来家里探望我的父亲，他发现我父亲的脚严重发炎，跟有血管阻塞。 他就劝我们必须马上把他送来医院治疗。所以第二天我们就把他送来Changi Hospital 的急诊室。急诊室的医生告诉我们，他必须马上安排他住院，因为他的情况很糟糕。我们办了住院手术，这个 Dr. Ho 来看他 ，Dr. Ho 解释给我们听说他的告诉我们他的情况很严重，他必须马上动手术，就安排了他动2次手术，一次是血管阻塞，另外一次手术是把他的左脚的尾指跟右脚的第4只脚趾切除，还有清理他的脚跟的那个他的伤口，因为妹妹的医生朋友告诉我们，他的脚趾已经发黑了，都不能再等了。 他是告诉我们这是个很大的手术，大概要12个小时的手术，因为我们也担心他的年纪也大了，因为他是74岁了，我们是担心他下不了手术台。不过经过那个手术他康复了，因为他的伤口是蛮大蛮多的。他在医院住了20天，20天过后就他们医生护士叫我怎么样清洗他的伤口所以他就出院回家了。出院回家每个星期他需要到回来医院清洗伤口3次。我们要谢谢医院Dr. Ho、Sister 素华还有助科的医生他们的细心照顾他的康复过程是蛮
顺利啊，
蛮快的啦，所以现在是他的伤口已经逐渐在愈合中了。
现在我的伤口也慢慢愈合了，我的体重也减了10多公斤，烟也戒了4个月了，没有抽烟了。我希望我的脚快点好起来，可以出去玩，可以出去吃东西。
Thank you, Mr. Lee and Madam Lee, for sharing your story and for joining us today for the official opening of the Wound Healing Center. Hard to heal or chronic wounds are an escalating problem worldwide, and these wounds tend to affect the elderly. As the nation's population ages, we are likely to encounter an increasing number of complex wound cases like Mr. Lee's. A key area of focus for the center is training, research, and continual innovation to address medical needs and deliver improved advanced wound healing outcomes to patients. Our co-director of the Wound Healing Center, Ms. Peng, and Dr. Vincent Tay, Associate Consultant at the center, will share more on this.
The care team at the Wound Healing Centers continue to keep themselves up to date with the latest in wound care. We are constantly looking into enhancing wound-related curriculum, certification and competency for nursing. Our team of specialists and nurses are certified by American Board of Wound Management as well as wound ostomy and continence practice. In addition, our care team at CGH Wound Healing Center is committed to drive innovation and research for wound care management. Our wound care nurses are looking into artificial intelligence for wound assessment and wound imaging to enhance wound care for patients.
Even though there are many ongoing research worldwide on wound healing, there remains much clinical equipoise with regards to various clinical scenarios and wound care solutions that are presented to us each day. Wound healing data in the tropics is limited. At CGH, we're always on the lookout for strategic partners to undertake various projects in research, innovation, and enterprise. Specifically at the Wound Healing Center, we believe that this can be a test bed for various new wound care solutions and also to conduct research in areas focusing on wound healing. Areas specifically like number one would be that of actually a good quality wound database. We believe that if you have good quality database that you can integrate artificial intelligence, you will be able to harness the power of big data. Secondly, will be that of conducting good quality clinical trials and product evaluation. This will allow us to not just evaluate products that are available in the market, but at the same time also examine how efficacious various new products are in our patient population. Lastly, will be that to keep our eyes open, our minds open for various innovation of emerging technologies. This we believe would be able to bring new, innovative, and efficacious and safe technology to our patient early in a very good clinical setup that we have here at the Wound Healing Center. One example would be that of our collaboration with our local biotechnology company, Cellogenics, which you will hear a bit more about later. This is a homegrown company that we're working with. We are looking at how we can examine and harness some of the wound healing technologies into a day-to-day wound care for our patients, such that their wounds can heal in a more expedient manner. At the same time, we are also examining some of the other evolving technologies that may eventually become a potential wound care solution. At the end of the day, what we're trying to do here is to identify unmet medical needs and to find solutions for them.
As part of our commitment to drive research and innovation for advanced wound healing, CGH will be signing a memorandum of understanding with local biotechnology company Celogenics. In the next presentation, we invite Celogenics to give a brief introduction of their research focal areas.
Celogenics is a Singapore biotechnology company spun off from the Agency of Science, Technology and Research, and we are pushing the frontiers in the development of future relevant solutions using breakthrough stem cells technology. As we face a growing aging population, we're seeing an increased prevalence of patients suffering from chronic diseases, and we are developing a new generation of life-saving, life-enhancing products to address these issues. Celogenics was founded in 2016, but our story is 10 years in the making. And today we're excited and humbled to be announcing our next stage of development as we partner Changi General Hospital to collaborate and develop therapeutic treatments and clinical applications for chronic wounds and neurodegenerative disorders, as well as clinical trials.
At Celogenics, we have developed a regenerative extract that is very consistent and potent in its ability to promote healing. The extract is obtained from stem cells that are isolated using a proprietary stem cell isolation technology that we out-licensed from the National University of Singapore and further developed here at Celogenics. We are currently collaborating with various partners such as the Skin Research Institute of Singapore, Nanyang Technological University, and the Wound Care Innovation for the Tropics program to develop accessible and affordable wound care therapies to treat chronic wounds such as diabetic foot ulcers and bed sores. Our preliminary data suggests that our regenerative extract can accelerate wound closure by 30%, which highlights our extract's potential in addressing the needs of the chronic wound care market. As our technology is a platform technology, it means that it can be potentially applied for many different applications. In fact, we are currently trying to develop our extract into products to treat neuromuscular diseases such as ALS and even skincare applications.
The development of the biotechnology sector in Singapore has come a long way since the foundation of A-Star in 1991. It has been recognized as one of the pillars of the new Singapore economy, with the government investing billions of dollars into this industry. We are very grateful to be in this space and to partner institutions like NUS, SRIS, and today Changi General Hospital as we endeavor to build a bridge from bench to bedside that has largely been a Singaporean effort. From therapeutic to cosmetic applications, breaking the frontiers of stem cell technology has never been so exciting, and we look forward to delivering innovative solutions that will benefit everyone.
Thank you, Celogenics. We would now like to invite our guest of honor, Senior Minister of State, Ministry of Health and Ministry of Manpower, Dr. Koh Poh Koon, Mr. Cheng Wai Keong, Chairman of SingHealth, and Mr. Koh Chun Hui, Chairman of Celogenics, to witness the signing of the Memorandum of Understanding.
May we now invite Professor Ng Wai Ho, Chief Executive Officer of Changi General Hospital, and Mr. Kurt Wee, Chief Executive Officer of Cellogenics, to sign the Memorandum of Understanding. CEOs, please. May we now invite Professor Ng to pass the folder to Mr. Wee. Mr. Wee will now pass the folder to Professor Ng. Both CEOs will now sign on the second document. Congratulations on the start of a meaningful partnership. May we invite the witnesses and signatories to remain on screen for a virtual group photo on the count of 3. 1, 2, 3. Thank you, and we look forward to a fruitful collaboration.
Distinguished guests, ladies and gentlemen, this brings us to the end of the official opening of CGH Wound Healing Center. On behalf of CGH, I would like to thank everyone for making time to join us in commemorating this important milestone. The CGH Wound Healing Center looks forward to playing a key role in the advancement of wound healing treatment processes and delivering improved health outcomes through research and innovation across the nation. Once again, it has been my pleasure to be your MC for today. Thank you for joining us, and we wish you a pleasant day ahead.